Good morning. My name is Tabitha, a pharmtechnologist working with City Health Hospital. And City Health Hospital is located at Odeon Cinema, first floor. That is a place you can get us. And today I'm just delighted to discuss with you a few things regarding chronic diseases. And by definition, chronic diseases are conditions that last for more than 1 year. That is the time we say this is a chronic disease or a chronic condition. And basically, there are many types of chronic diseases. We have hypertension, we have diabetes, we have arthritis, we have cancer. There are a list of them. But today we are just going to discuss about diabetes and hypertension, just in brief. And starting with the diabetes, we have two types of them. We have type 1 and type 2. And when you talk about type 1 diabetes, in layman's language, we say diabetes that one is born with. And this one basically affects mostly infants and children. And when we talk about the type 1 diabetes, is a condition where one is born, maybe you lack production of insulin from the pancreas, and basically you find these are people who normally use the insulin, the injection. And when we come to type 2 diabetes, mostly we say the cause is really unknown, but this one comes in life. Basically it affects the aged, and also it comes with the age. And when we talk of the same, there are so many theories on the causes of the same. At times we say that it is genetic. If you have a history of people in the family that have the same issue, you find one or two people affected with the same. Also, type 2 diabetes can also come due to obesity if they are overweight. That is why we encourage people to observe what they eat to manage their weight. And also other things like if you take a lot of alcohol, you also smoke, at times you find it can lead to the same. And nevertheless, during this time when we have the pandemic, COVID-19, we are also finding so many people are stressed up. And when they come to visit our facility, you find they didn't have a history of diabetes, but you find somebody kind of developed the same. And this one, we find that sometimes stress can also make somebody to have diabetes. And when we come to the same, there are so many ways that one can be able to manage diabetes. And as I started, I said type 1 diabetes, you need to use the insulin plus other medication, because you don't have the insulin that is enough to bring down the glucose in your body. But when you come to type 2 diabetes, basically that one can be managed. Even at home, you can manage that. And maybe we can't say that for sure that you can get out of type 2 diabetes, but it is manageable. You can always reverse the same. And one thing right now, when we find so many people at home, maybe others are not able to visit the hospitals, and we find maybe our folks back at home, they are not maybe able to come and see maybe their doctors, then again we would like to advise them on how they can manage the same at home. One thing, we encourage doing a lot of exercises, and we find maybe the old, you cannot maybe tell them to do the physical exercises, but you can encourage them to be active. They can take a walk every morning, and that is also part of the exercises. Also to manage their diet, to take the right foods. And we encourage that part of taking the right foods, especially avoiding sugary beverages, avoid like white bread. That is one of the things that one should avoid. And also it is also important also to observe your weight at home. Don't take foods that, especially now that people are not really active, doing a lot of things, moving up and down, then again we really have to observe the diet. What you are eating really matters. And with the time, when you manage with the diet, you find you can also reverse. You can reverse the same, but not really to heal the disease, but you can reverse it. And you find yourself, at least you have come to the normal sugar levels. So that is one way that we encourage people to do at home to manage the same. But nevertheless, it is also important that as much as maybe you are observing the diet, you are doing a lot of exercises, this one goes hand in hand with the use of other medications. And times we are finding that people are having a challenge of how to get their medication. Here at City Health, we are trying our level best to manage our clients, to manage those patients who are not able to reach to our hospital. We are doing a lot of deliveries. What we need is just to get in touch with you or get in touch with us, and maybe we get the prescription that you normally use, then we are able to deliver those medications. And also it is important that maybe as much as maybe you're using your medication, it is also important to come and see the doctors. And if you're not able to come and see them in a hospital, we are still having our online doctors who can be able to, you can be able to discuss with them. And we encourage maybe you keep the records of your daily readings of your sugars. You record them somewhere, and then maybe after a week or 2 weeks, you can share with our doctor and can see if the medications you are using, if you still continue with the same or you need changes. That is how we are working with our clients. So for now, them that maybe you are not able to visit the hospitals, you are not able to access your medication here at City Health, we are doing delivery of the same medication. You can also be able to reach our doctors and discuss the same. We also have machines that you can be able to do them at home. You can take readings of your sugars at home. We have very good machines that are easy to use. Even the old can be able to learn and know how to use them, and they can be doing it at home. But if they are not able to do it at home, still we have nearby clinics where they can go and take the readings, and then they talk to our doctors and we get the readings, and we can advise on the same of what to do. We really discourage the use of the medication for a long period. You find you have some people, maybe you have a prescription that maybe you have used it for the last 1 year or for the last 6 months. What you do is just replenishing your medication all the time. This is the medication. It's like you know what you normally use, so you keep on repeating the same prescription. At times we discourage the same, especially for type 2 diabetics. You find if you're managing with the diet, at times you come back to the doctor, you discuss with the doctor, and then maybe can advise, because your sugar levels are almost normal, then maybe you find some doctors will advise you to reduce the same medication, or if you're not improving, they can change the medication to one that will be able to manage your sugar levels. Now when you come to the next one is the hypertension. Hypertension, we have two types that I'm going to discuss. We have the primary hypertension and secondary hypertension. When we talk about the primary hypertension, this is what we say that the cause is unknown, because it's something that it develops. You can't say this is the exact cause of the hypertension. But basically, as I said about diabetics, you find these two diseases go in hand. If you find somebody who is diabetic, at the end of the day, you might find has the same hypertension. If you have hypertension, at times you find yourself having the same diabetes. So they kind of go hand in hand, and management is almost the same. But for hypertension, especially the primary hypertension, you might find there are some various causes. As I said with the diabetics, still you can find we have some genetic causes. If you have a history of the same in your family, at times you find 1 or 2 people also on the same lineage suffer the same. We also have like people who use a lot of alcohol. If you consume a lot of alcohol, this one can also cause the primary hypertension. Smoking can also cause the same. You also find lifestyle, the way you do what kind of food do you eat, how do you manage yourself. Sometimes you find you become overweight. If you become overweight, again, that can also cause the same problem, the same primary hypertension. So when we come to the same about hormone management, you also need to manage yourself. You can manage it. Doing a lot of exercises, that is really encouraged. Also, observing your weight is also another thing that you're supposed to do. But nevertheless, it's also important. If you have medication that you're using, Even if maybe you go take your blood pressure and you find it somehow normal, you find there are those ones say that, since my blood pressure today is okay, I'm not going to take my morning medication. I'm going to skip my medication. Maybe it's good to understand that when using hypertension medication, it is not right for you to stop taking medication unless advised by the doctor. You cannot just stop at once. If the doctor wants to reduce the medication, he will reduce them slowly by slowly, reducing the milligrams of the drugs that you are taking until you stabilize. But if you stop at one go, that now I think I'm okay, I think I don't want to use this medication again, then the moment you stop, then again it affects the pressure that you have. You can find it shooting up again just because you stop the medication abruptly. That is not advised. It's good always to contact your doctor. If you take your blood pressure measures and you find that they are normal, then again you need to contact your doctor. You need to talk to our doctors because we still have them online. You can talk to them anytime and they are ready to help you. So, and for now, the same as I said, we are still doing delivery. It is important for you to take medication, not to skip the medication. At times you find maybe you have medication for 1 month. Don't wait until the last minute. You only have a dose for that day. You don't have medication and you don't have a place where you can source. You can always send us your prescription even a week before, and then you tell us this is the day the medication are getting finished. Then we get in touch with you. We can call and confirm if we can do the delivery. We remind you that you need to refill your medication. That one we do it comfortably. So at City Health, we are there for you. We are there to serve you. And with the pharmacy, we have all types of medications. You can never lack of what you use. And we respect what the doctor prescribes for you. We will always talk to you. In case you have any challenges, in case you have any side effects, you experience any side effects of the drugs maybe you are using, always call back. Always let us know so that you can be able to communicate together with the doctors, and it will ensure that you don't miss your drugs and your drugs will get on time, and you talk to our doctors. And we encourage after every 3 months, 3 to 4 months, it's good to come back and see the doctor. See them physically so that we can check on you, you can check on your wellness and advise the way forward. Thank you so much. May God bless you.